Pakistan is now requiring everyone leaving the country to get vaccinated for polio. This after the World Health Organization declared the virus an international public health emergency and imposed travel restrictions on anyone leaving Pakistan without proof of vaccination.
The WHO says Pakistan, Syria, and Cameroon have allowed polio to spread beyond their borders and must take action to stop it. On assignment's Alexiou talked with VOA correspondent in Pakistan, Sharon, Behn, about Pakistan's side of the equation.
Pakistan has ordered mandatory polio vaccinations for anyone leaving the country's tribal northwest, where the virus is concentrated. The World Health Organization has imposed international travel restrictions on anyone leaving Pakistan without proof of vaccination as of June 1st.
How far has the disease spread outside of Pakistan? Do we know that?
Well, that's exactly why the WHO imposed recommended this travel ban, was because the polio virus, the strain that actually exists here in Pakistan, that virus strain was found in Afghanistan, and it's been found in Egypt, and it's been found in Gaza, for example. So the ban was actually put because the strain was being exported. People were carrying it abroad, and then in areas where normally there isn't polio, that virus was being found in sewage water, for example. So that's why the WHO put on that travel ban. If you leave and get a vaccination, that vaccination will have to be done annually until there is proof that no more virus has been exported from Pakistan.
Much of the country has been inoculated, leaving the virus concentrated in Pakistan's volatile tribal regions. The Taliban banned vaccination efforts there in 2012, meaning it remains out of health workers' reach.
So once the teams arrive in a particular village, are the people willing to take the medicine? Are people scared to take it from fear from the Taliban?
Yeah, I think you're right. And I think there are a couple of problems involved. One is that the polio vaccination teams cannot get to those areas. There's no security. There's not enough security. Even when they're getting close to the areas, they have been attacked multiple times. The polio health workers have been killed. Police escorts taking them to the slightly more volatile areas have also been killed. They've been killed in the southern city of Karachi also. So it's very difficult for the polio teams to even get anywhere close. And yes, there is a degree of fear by those living under that area that, if they do take their kids, bring them down closer to where the vaccination teams are and get them vaccinated, that, they might get found out. The Taliban can exact revenge. So it's a quite complicated problem.
What kind of protection is actually offered? Obviously, it's not enough.
Right. Well, these teams tend to be young, what they call lady health workers. They're female polio vaccinators who will go to the villages, and they go door to door and give the vaccination as the polio drops. And normally now they're escorted by teams of police. But now the government is saying that they will try to include the military to help protect the polio health workers. I think part of the problem, what officials are saying off the record, is that there are quite a few problems with even the delivery of the polio vaccine as it's being delivered now. They have the vaccine is a live vaccine. It's those little drops that you see being put into children's mouths. They have to be kept at a certain temperature, a certain cool temperature. But they're carrying around these little sort of, food coolers. And there's no real way to gauge whether it's at the right temperature. And I think that's going to be one of the problems. It's hard to gauge if the vaccination is being done at the proper temperature and, to gauge how many people are actually getting the vaccine.
It's spreading, but in Pakistan anyway, what sort of numbers are we looking at as far as how many people may have polio now?
It doesn't sound very high. The problem is for every child that actually develops the disease, thousands of others are actually infected. And that infection can then spread. It spreads very quickly. It spreads through water. It spreads through, fecal matter and so on. So it's very difficult. Just because only one child is showing evidence that they've been infected, actually thousands of others are infected and carrying it, which then spreads quite quickly. When it goes to other countries, for example, it was found in Egypt. Egypt has had a very effective polio vaccination campaign, so it's not expected that anybody will get the virus. But in any area where there's upheaval and perhaps they haven't been able to keep up their campaigns, that's when the virus can erupt, like it did in Afghanistan, from here to there.
VOA Islamabad correspondent Sharon Behn. Adding to the obstacles for these vaccination campaigns are the conspiracy concerns some people have about them. In 2011, the U.S. Central Intelligence Agency set up a fake hepatitis vaccine program as a way to locate Osama bin Laden. The Obama administration says the CIA no longer uses immunization programs as a cover for spying operations.